Doreen, Dallas, Texas, the great WBAP. Go.
Hi, Mark. It is a pleasure and an honor to speak to you. I've been listening to you for years, and I'm so glad I got through. I actually have a medical practice, and I need to let you know that
Wait
there's
a minute.
something they're not...
Whoa. Are you a doctor?
Yes, I am. And they are not telling you what is going on. What is really going on with these patients with the Obamacare plans, when you call to verify what they're going to pay you and you verify their insurance for a certain code of service, they don't have fee schedules made out. So you cannot find out what you're going to be reimbursed for any level of service you provide this patient. What that means is you go back to the patient and you say, I don't know what I'm going to get paid, or I have to go into a mediation process with your insurance company to bid for a price that they're going to pay me. We go back and forth until we settle on a price, which is time-consuming and ridiculous. So the patient then has the burden put back on them to make the payment in full and then file it with their own insurance. They're getting very upset over this. We're telling patients this, and they're getting extremely mad. But the government will not tell you this. So I don't know what the answer is going to be to that, but no fee schedules are made out.
So you don't know from month to month when you're paying your staff, you're paying the lease, if you own the building, the mortgage, you're paying for some expensive equipment and this, that, and the rest. You don't know what your income is likely to be month to month, do you?
That's right, you don't. And so how can you plan to hire...
Oh, excuse me, this is progress, Obama said. This is what civilized societies do.
Exactly.
No, he's a jerk that's never had to rub two nickels together. He's a guy that's had everything handed to him. He's never had to work at a grocery store. He's never had to be a janitor. Mark, you weren't. Yes, I was. He's never had to do any of these things. And yet he can recreate the whole world.
And we didn't build it. He built it. The government did this. They paid for my school and everything. No, I paid my own stuff. I had my own student loans. I worked hard all my life. No one gave me anything. My parents were poor.
Well, Dr. Doreen, let me ask you a question before we run out of time. When people say things like, or Obama says things like, health care is a right, I think to myself, really? So doctors, do they have any rights? And nurses, do they have any rights? And people who are providing the services, do they have any rights? Apparently not. I mean, what are they talking about?
No. You have a right to the information to learn to take care of yourself. You have to take ownership for your own health and your own health care. I wrote an article many years ago that was published in a journal about that exact topic, is health care a right owed to Americans? It was back in 2002 it was published. And it's very funny how all of a sudden now we have this horrible health care system that's evolving in front of us, and all of these people think that health care is a right to them. It is not a right to them. Sorry, I don't feel that.
No, because people have to work, people have to invent, people have to make a living too. We have other human beings in this country too. It's not just the takers. All right, doctor, I wish you all the best. You're going to need it. I hate to tell you that. And so are we patients. We're going to need it too. This helps nobody. It amazes me. The vast majority of Americans don't trust politicians as far as they can throw them. And yet apparently a huge chunk of our fellow citizens trust politicians with their health care, with their livelihood, with everything. That's why I call them drones.